Hello and welcome to the Capital Stewards Podcast. Today we're tackling the single largest expense that most of you will face in retirement, one that's historically outpaced inflation, and that is healthcare. But before we do that, I want to share a few thoughts on the war that is going on in Iran and really the broader Middle East at this point. I sent a note to our clients and our friends this past Sunday, but my perspective hasn't really changed since then, but I thought I would share just some thoughts on the podcast as well. First off, regardless of your political position on the conflict, we should all acknowledge the human cost and the human sacrifice that comes with war. Some of our soldiers have already paid the ultimate sacrifice. They've paid with their lives, and we can and should pray for their families and for the rest of our armed forces that are still in harm's way, doing, frankly, the hard work that keeps our country free. In my note on Sunday, I mentioned that we expected to see market volatility this week, and that has turned out to be certainly true. The key to navigating these kinds of events is to be prepared ahead of time through proper diversification. That's not just owning different stocks or looking at your brokerage statement and saying, hey, I own a lot of different things, but it's by owning a variety of assets that have different kinds of underlying economic exposure. They react differently in times of crisis. That kind of resiliency in your portfolio should allow you to look for opportunities in these moments instead of playing defense. It's also important to remember that geopolitical events seem really acute in the short term, but most wrap up in a few weeks and have less economic impact than originally anticipated. In fact, markets tend to be higher 6 months, 12 months after these kinds of conflicts. So it's important to keep your long-term goals in sight and not lose track of what you're trying to accomplish through investing if you're just drowning in the drumbeat of the news every night. As we look forward in this particular conflict, the most important economic impact of this war is really from Middle East oil exports being constrained. That drives up oil prices. We've seen that. The longer that continues, the more impact it's going to ultimately have on inflation and on consumer spending in the U.S. So we'll continue to watch oil prices, and we'll hope for a successful and rapid conclusion to the conflict. All right, so let's turn back to the topic at hand today, and that is retirement healthcare. In 2026, the landscape of care has shifted. Medicare Part B premiums crossed $200 for the first time in history, and there's a lot of new legislative changes that came out from the One Big Beautiful Bill over last summer. So healthcare advanced planning is more important than ever before. So today I'm going to break down the top concerns for those of you that are retiring and think about it the next 24 months. Also for those of you that are planning for the long term. And we'll even talk a little bit about specific strategies that you can implement if you're already in retirement to plan for your healthcare needs. So with that, let's dive in. If you're planning to hang it up by 2028, if you're going to retire, or even if you're thinking about retiring early now, and you're maybe planning for that for 5 or 10 years from now, your biggest hurdle isn't just the market. It's what I call the insurance bridge. If you retire at 62 or before age 62, that means you've got at least a 3-year gap to bridge before Medicare insurance coverage kicks in. If you don't have coverage through a prior employer or as a result of government or military service, the private healthcare exchange based on income, and that's true. But the limits have been reduced. Some of that was some of the changes that got made last summer in OBBBA. And it may be more importantly than the income thresholds being reduced, the cost cliff has returned. And what I mean by the cost cliff is that if your income is $1 over the limit, the move from receiving a subsidy that's worth more than 80% of the cost of your insurance bill to being responsible for paying the entire bill is instant. It happens if you're just $1 over that threshold. So an unexpected capital gain from selling a stock or an extra withdrawal at the end of the year from a retirement account can now trigger a massive tax bill just because you have to pay back those healthcare credits in full. So I'll walk you through an example that kind of maybe makes this more concrete. So silver plans for couples in their early 60s. So on the healthcare exchanges, generally you've got bronze, silver, and gold plans. Gold plans, obviously most expensive, most benefits, lowest out-of-pocket cost. And then bronze plans have lower premiums, higher out-of-pocket cost, and then silver plans sit somewhere in the middle. So that middle tier plan, the mid plan, the silver plan, for a couple in their early 60s, that's going to run about $3,300 a month in Alabama, almost $40,000 a year. So if you've got $80,000 in taxable income, if you have $80,000 in income, you're only responsible for about $650 of your healthcare premium each month. That means you get a subsidy for $2,650 every single month. That's a significant benefit. However, if your income moves through the maximum threshold for subsidies, which is 84,600, that entire subsidy goes away. It doesn't scale back. It doesn't decline as your income goes up. If your income's over the threshold by $1 at $84,601, you lose the benefit that equates to almost $32,000 a year. So there's two problems here to manage. First, you need to be able to fund health insurance premiums, right? To start with, we got to have savings to be able to do that if we're going to retire before 65. And then secondarily, we've got to carefully manage taxable income if you're relying on those subsidies to help cover part of the cost. So here's two ways that we approach that generally with clients today. So the HSA, or the health savings account, if you're still working, contribute to a health savings account. You can't use these to pay for private insurance, but you can use it to offset out-of-pocket medical expenses that you would otherwise have to pull money out of those retirement accounts or out of your IRA or out of your 401k, which increases your taxable income. We know that medical expenses in retirement, they don't always come when we expect them to or when it would be convenient for them to come for tax planning purposes. And so having a tax-free pot of money that you can go to cover some of those out-of-pocket medical expenses is really valuable when you're managing your taxable income in retirement. And that kind of leads to our second strategy, which is income engineering. So if you're in that bridge period, or if you think you're going to be in that bridge period, we've got to keep your modified adjusted gross income, the MAGI, the abbreviation there. We got to keep that low to qualify for the subsidies. That doesn't mean that your spending can't exceed $84,000, but your taxable income cannot exceed $84,000. So that means we've got to use taxable investments or Roth assets for living expenses to keep your taxable income down during those years. And then you can shift to using those other assets when you turn 65 and you become eligible for Medicare. So let's talk about care specifically for those of you who served in the military or in the federal government. You may have been told that you have sort of the gold standard for retirement benefits. And that's true. You will have a very low. We tend to see healthcare expenses in retirement be very low compared to sort of your private sector peers. But that doesn't mean that you don't need to have sort of an active approach to managing those before and when you get into retirement. So this year, federal employee health benefits, FEHB premiums are up. The enrollee share for FEHB benefits, the premiums are up 12.3% this year. The Office of Personnel Management cited an aging workforce and a massive surge in the cost of GLP-1 weight loss medication as the main drivers for the increase. So maybe if you're paying for the insurance, maybe you should get GLP-1s. I don't know, because it seems like you're paying for it anyway. So, and the second component to think about if you are a federal worker is kind of the Medicare Part B dilemma, right? One of the biggest questions that we get is, hey, I have, federal employee healthcare benefits. Do I really need Medicare Part B? And we're leaning toward yes for a lot of our clients. Many of the federal employee plans offer Medicare reimbursement accounts that can kick back, $800 or maybe even more in some cases to cover your Part B premiums. And if you skip Part B, you obviously reduce your insurance premiums, but you miss out on kind of the wraparound effect of that, which generally brings your out-of-pocket medical costs down to nearly zero. It makes you look a lot more like a military retiree in those kinds of situations. So you're kind of taking a gamble of like, hey, if you think your healthcare costs are going to be really, really low, you can save the Medicare premiums. But if something does happen, your costs are going to be much more well managed if you have both sets of insurance, one that's kind of acting primary and the one that acts almost like a backup. So for military members, former military members, retired service members, your healthcare solution in retirement is going to be TRICARE for life plus Medicare Part B. And that's kind of non-negotiable. There's not really a choice. You can go to the VA if you're disabled, right? So I'll talk about that more in a minute. But for most folks, it's going to be TRICARE for life and Medicare Part B. To keep your TRICARE for life, you have to be enrolled in Medicare Part B. So it's really important that you do that and that you do that on time. Medicare, when you are retired in the military, Medicare still acts as your primary insurance. A lot of people miss that. They think TRICARE is going to be their coverage. Medicare is your primary insurance, and then TRICARE acts like a backup for expenses that aren't covered by Medicare. So the result of that is that your out-of-pocket expenses will be really, really low, again, compared to your sort of private sector peers, but you have to have both and you have to enroll in both at the right time. For those of you that have VA benefits, if it's possible, we kind of suggest using those as a last resort. VA care and wait times have improved over the last few years, pretty dramatically actually. But the breadth of choices that you're going to have for doctors and care, they're still not the same as someone that is using a combination of Medicare and TRICARE. So if you have the option to do Medicare and TRICARE, perhaps that's your first choice, and then VA benefits, disability benefits would be kind of a backup to that. So for those of you that are already on Medicare, it's kind of the good, bad, and ugly for the past year. So the bad news is Medicare Part B premiums are now over $200 a month. So that's the first time they've been over $200 a month historically. It's a 10% jump from last year. And for higher earners, the IRMAA surcharges are even steeper. So if your joint income was over $218,000 2 years ago, you're not paying $200, you're paying $650 a month now per person in 2026. Even uglier, we're seeing a lot of challenges in the Medicare Advantage system. We're seeing major insurers pull out of hundreds of counties every single year. So if you're on an Advantage plan, you want to check your network, make sure that your providers are not being dropped. Because what's happening is the government is reining in a lot of payments to those private plans. And some of that may be good from a government spending standpoint. Maybe some of that was fraud, but it's less money going from the government to the insurers. And that means that they are going to then try to cut the cost of their programs. There is a silver lining, thanks to some sort of recent negotiations between the Trump administration and insurance plans. The sort of top 10 most common drugs, the cost on those has gone down. So that's good news. And your Part B out-of-pocket drug costs are now capped at $2,000 a year. So that's a big win for folks that had more expensive medications that they were on before. So there is some good news, even though costs are generally going up if you're in Medicare, just generally in 2026. One of the things that's really important that we are always tracking for clients is the 2-year look-back period. I mentioned that earlier when I was talking about premiums. Remember that your Medicare premiums are based for 26 are based on your 2024 tax return. So it's a 2-year look back. So you need to manage your income for a couple of years before Medicare and then consistently while you're on it to avoid those Medicare surcharges. If you do have what Medicare calls a life-changing event, and there are specific things that qualify for that, retirement is one of them. So if your income goes down dramatically as a result of something that changes in your life, you can file to have your premiums reduced based on your current income, but it's important to know when and how to do that. You got to navigate that correctly, and you got to be tracking your income along the way so you can provide all the necessary support in your filing. So even if you're just on Medicare, there's still some administrative and sort of strategic things you need to do to make sure that you're keeping your costs as low as possible. Let's talk about long-term care for a minute. A private room in a nursing home is now averaging about $130,000 a year. So the right approach to long-term care is first to analyze whether you can self-fund. If you're planning to spend more than $200,000 a year in retirement, you might not need separate insurance coverage for a long-term care situation. It may not be pleasant to pay for that stuff out of pocket, but probably you're going to be better off self-funding if you can versus buying what's fairly expensive insurance. If self-funding is not an option, then you want to consider buying long-term care policies while you're in your 50s. That's when premiums are still low enough that you can at least break even on the policy. If you buy long-term care coverage too late, it's at best a break-even proposition if you use the long-term care insurance, and at worst, it's just a wealth transfer from you to the insurance company. You lose money in the deal. So it's important to start early if you're going to think about long-term care. When we talk to clients about long-term care, we also suggest sort of throwing away those older sort of use it or lose it kind of policies. We're seeing a big shift towards hybrid life and long-term care policies. That's where you put in a lump sum or you pay annual premiums. If you need care, you have a pool of benefits to draw from. And then if you don't need long-term care, your heirs still get a death benefit. So you're sort of splitting the difference between a pure insurance product and something that also has a little bit of a financial, benefit as well. So I think, again, the key is to long-term care. Plan early and think about it. If you're going to buy long-term care, think about it in terms of maybe a hybrid life long-term care policy. So what are the next steps that you can take to start planning your retirement healthcare expenses short term? So first thing, make sure that you have healthcare expenses baked into your budget and retirement plan properly. We talked about those kind of in the upfront, right? Those can be $40,000 plus a year if you're, pre-Medicare, and then you're talking about, maybe up to $600 a month just to buy Medicare when you're on it. So a lot of times we're seeing folks spending, a married couple spending, 20 to 30, even $40,000 a year on healthcare expenses in retirement, depending on what their situation is. So make sure that you're planning for them properly. Also, those expenses change dramatically when you retire. So it's important not to assume that your healthcare costs today simply sort of continue. You probably have employer-sponsored coverage. The benefits are different. You're younger. It's less expensive to insure you, all those kinds of things. So it's important that you think about what are my actual healthcare costs going to be in retirement and then bake those into your plan. Second, you want to think about where your assets are located. If they're primarily in a 401k, in an IRA, or a taxable pension, you should really think about Roth conversions or other strategies to create tax-free income in retirement. This is especially true if you plan to retire before 65 so that you can keep your income, your taxable income, below the thresholds to qualify for premium subsidies. You also might want to think about opening a health savings account, an HSA, to supplement your Roth to give you sort of an additional tax-free layer of income. And then lastly, if you're in your late 40s or 50s, the time to start planning is now, right? Think about conversions. Those things work better over the long term versus doing them short term. Think about long-term care insurance. Waiting until right before you retire will limit your ability to control your income and have optimal healthcare. And we want you to have optimal healthcare, to be healthy and enjoy your retirement. Being healthy is a big part of that. So, all right, so that's a wrap on this episode of the Capital Stewards Podcast. Hopefully you find this helpful as you think about healthcare planning for your own retirement. If you have questions or you want to talk to somebody about your healthcare needs in retirement, we're always happy to have conversations about how we factor that into clients' financial plans. You can start a conversation with us. There's a link in the show notes to start a conversation with us. And we will see you next time on the next edition of the Capital Stewards Podcast.